Have you ever wondered about the difference between HIV and AIDS? What they are, how they affect our bodies? Today we're going to delve into this important topic. Human immunodeficiency virus, or HIV, is a virus that causes acquired immunodeficiency syndrome, or AIDS. The human body has a defense system known as the immune system, which fights off various viruses and bacteria. HIV attacks this defense system, specifically targeting a type of white blood cell known as CD4 cells. Without medication to control the virus, HIV hijacks these CD4 cells and transforms them into factories for producing millions of virus particles. This process destroys the CD4 cells, weakening the immune system and eventually leading to AIDS. There are different types of HIV categorized into two main types: HIV-1, which is the most common and found worldwide, and HIV-2, which is mostly found in West Africa, Asia, and Europe. It's possible for different types of HIV to exist in one person's body at the same time. Moving on to AIDS, it represents the final stage of HIV infection. HIV weakens the immune system by attacking the CD4 cells, leading to the onset of AIDS. When the body loses a significant amount of these cells, it becomes susceptible to severe and potentially deadly infections, known as opportunistic infections. When a person dies from AIDS, the cause is usually these opportunistic infections and the long-term effects of HIV. AIDS signifies a weakened immune system that can no longer fend off these infections. There's a distinction to be made between HIV and AIDS. Simply having HIV doesn't mean you have AIDS. You can live with HIV without symptoms or only mild symptoms for many years. People living with HIV who follow recommended treatments can significantly reduce their chance of developing AIDS. However, without treatment, HIV eventually reduces the number of CD4 cells to a point where the immune system is severely weakened, making opportunistic infections likely. To recap, HIV is a virus that attacks the immune system, specifically targeting CD4 cells. If left unchecked, this can lead to the development of AIDS, which is the final stage of HIV infection characterized by a severely weakened immune system and susceptibility to opportunistic infections. With effective treatment, people with HIV can maintain their health and significantly reduce their risk of developing AIDS. Understanding these distinctions is crucial for tackling the global challenge of HIV and AIDS, and for supporting those living with these conditions. Remember, knowledge is the first step towards action.